The bright side of addiction is recovery, and recovery is the great provider, offering hope, healing, and happiness. If you're in recovery or know or love someone who is, or simply want to know more about the recovery process, or maybe you're a bit concerned about someone you know or love who has been harmfully using alcohol or any other drug, this is the podcast for you. We carry the message of hope and the promise of recovery. And a reminder, you can find all of our podcasts at recoverycoasttocoast.org. Recent episodes have featured an interview that I did many years ago with Betty Ford, actor John Larroquette, astronaut Buzz Aldrin, musician Bonnie Raitt, authors Brene Brown, Anne Lamott, J.A. Jance, former NFL players Ryan Leaf and Thomas Hollywood Henderson. All these interviews and more are on our website. Plus, conversations with everyday people in long-term recovery, sharing their story, their insight, their path. We welcome you to Recovery Coast to Coast, the national podcast. In this podcast, we are going to meet a man who has been charged with recognizing that recovery is an American way of life. He is the director of the Office of Recovery. It's under SAMSHA, the Substance Abuse and Mental Health Administration. Here is a quick clip from our conversation with Director Del Vecchio.
I was at the point where I was going to end my life. On that day, on a subway platform in North Philadelphia, I left that platform and found a life-changing experience when I met other peers on that day. And I found I wasn't alone. I found that recovery was possible and that there was hope.
My conversation with Director Del Vecchio of the Office of Recovery is coming right up. I'll also share a comment from the governor of the state of Washington about statewide support for recovery. I'm Neil Scott, host of Recovery Coast to Coast, with a sincere, heartfelt thank you. There's a lot of podcasts about recovery out there, and a lot of them are really, really good. So I appreciate you taking your time to listen to ours. Your time's valuable. I appreciate it, and I hope that if you enjoy it, you will share it with a friend. Our website, by the way, recoverycoasttocoast.org. Following 17 years of nightly broadcasting on iHeartRadio in Seattle, our podcast features interviews with everyday people in long-term recovery, as well as clinicians, authors, and recovering celebrities who offer that promise of hope and that reality of recovery. Plus, we give you well-vetted resources for individuals, families, and friends. We invite you to enjoy the podcast and to share it with your friends. Recovery is living proof. A reminder, our email address is recoverycoasttocoast@comcast.net. We would love to hear from you. Recovery Coast to Coast is supported by Sundown M Ranch, one of America's oldest, least expensive, and most successful treatment programs. If you are considering sending someone you know or love to treatment, that's very stressful. I mean, who do you call? There are literally thousands of treatment programs around the country that all claim to be the best. There are expensive programs. There are programs that offer luxury accommodations, others that have seductive advertising both online and on television. It's very confusing. Meanwhile, the person you love or care about is in desperate need for immediate help for a chronic disease that is only getting worse. Well, first of all, do your research. Consider a program that has been operating for a long period of time, a program with a solid history. Next, find out about their staff. Check the credentials. How long have they been at that center? Does the center have a big turnover rate for staff? Now, these are important considerations. And are they members of NAATP? This is very important, as this association has been the guiding light for nearly 50 years, and their members adhere to strict guidelines, including a stringent code of ethics. Be warned, there are a lot of bad actors out there. And of course, then there's the cost of treatment. Well, Sundown certainly checks all the boxes and more. They've been successfully treating individuals and family members for the past 55 years. Their staff has been together for a long time. Many have gone through treatment at Sundown themselves years ago. They are well trained. They are well paid. They love what they do. And yes, Sundown is a proud member of NAATP. And as far as the cost of treatment is concerned, it's among the lowest in the country. Since they are a not-for-profit program whose bottom line is the patient's recovery, they own their own land, 30 acres, not far from Seattle at the mouth of the Yakima River Canyon. Yes, do your research on treatment. And please, please consider Sundown M Ranch. Sundown.org, where recovery begins. All right, time for a cup of coffee and time to find out about the government's Office of Recovery. Now, their director, Paolo del Vecchio, is doing an upcoming keynote address at the Texas Association of Addiction Professionals in San Antonio, Texas. He's going to give us a preview of that presentation as well as an overview of the Office of Recovery. Did you know it existed? Well, you're going to find out about it right now. We welcome you back to Recovery Coast to Coast, America's voice for recovery. Great to have you with us. You know, a lot of people wonder, what is the Office of Recovery? People don't even know about it. Well, the Office of Recovery is under the Substance Abuse Mental Health Services Administration, commonly known as SAMSHA, which is in the Department of Health and Human Services. The director of the Office of Recovery is Paolo del Vecchio. He's an interesting man. He's in recovery from mental illness, addiction, and he is a trauma survivor as well. He recovers out loud. He's going to be keynoting at the 49th annual meeting of TAP, which is the Texas Association of Addiction Professionals. I will be down in Texas emceeing that and look forward to meeting him in person. Mr. Del Vecchio, welcome to Recovery Coast to Coast.
Thank you, Neil. It's great to be here.
You know, many people are unaware of the Office of Recovery. When was that established, and how does it impact the recovering community?
SAMHSA's Office of Recovery, and I should note, Neil, this is the first time ever that at the federal level for the Substance Abuse and Mental Health Services Administration to establish an office specifically to help advance recovery across the nation. And that was due to our leadership, our Assistant Secretary, Dr. Miriam Delphin-Rittman, and our Deputy, Tom Coderre, a longtime person in recovery and recovery champion. Our office puts the spotlight on how we can help people find hope and healing to overcome both mental health, addiction issues, and live full and happy, productive lives in the community with their loved ones.
You are in recovery from mental illness, addiction, and a trauma survivor. How does your personal story, your background, support the work that you are doing today?
Well, this, for many of us, Neil, right, this is it's not just a job, but this is personal for us. Having that lived experience and living experience, I'll add as well, provides that knowledge and insight about what it takes. Most importantly, Neil, it provides that passion that we need, that energy to help expand and mobilize recovery across the nation. You know, our data shows that fully 7 in 10 individuals who've had an addiction problem go on and find recovery. And our goal really is, how can we assure there's recovery opportunities for all Americans? And, having that lived experience, not only for myself, but for all the recovery community, just helps drive us to achieve that goal.
How long have you been in recovery?
I've been in recovery this month. In October, it'll be 38 years for me.
A newcomer.
For me, when I found the recovery community after experiencing major mental health and addiction issues, and I was at the point where I was going to end my life. On that day, on a subway platform in North Philadelphia, I left that platform and found a life-changing experience when I met other peers on that day. And I found I wasn't alone. I found that recovery was possible and that there was hope.
You were doing the keynote presentation at TAP, the Texas Association of Addiction Professionals. Can you give us a little preview of what you will be talking about down there? It's a great conference. I have been emceeing that for a number of years, and I'm sure you'll be welcomed with open arms. But basically, what is your talk about?
I'm going to talk a little bit more detail, Neil, about the Office of Recovery. We just celebrated our 1-year anniversary, and I'm going to talk about some of our activities and goals over the past year. One of the efforts I'm going to focus on is around the peer workforce. And certainly over the last several decades, we've just seen the explosion in the number of recovery coaches and peer specialists working throughout the addiction field. And we issued earlier this year a set of national model standards around peer support certifications, and I'm going to talk about that.
Yeah, yesterday I had the opportunity to meet with our governor in Washington State, Governor Jay Inslee. He was at an event celebrating 50 years of a treatment center, Evergreen Treatment Center outside of Seattle. He said, when people get the chance, they take it. And I asked him to elaborate on that. And his quote is, I think there are misconceptions about recovery. One is that it doesn't work. Well, in fact, it does. When you get a person with motivation and you give them the resources, very frequently they can recover. And it's a hard road. This is not an easy thing. And sometimes you have to do it twice, sometimes 4 times. But the number of people I have known who've recovered and returned to work, returned to their families, it is an extraordinary success story. The demand is growing, unfortunately, and I'm glad the state is stepping up to the plate. And I'm certainly glad, Paolo, that the government is stepping up to the plate with the 1-year anniversary of the Office of Recovery. And let me ask you, what have you seen as the biggest change in the past decade? You've been doing this a long time.
Yeah, I would probably cite a couple of things, Neil, there. I cited already the incredible development of peers now providing services as recovery coaches and peer specialists, and places like jails and prisons, for instance, where we've never seen that before, helping spread the message and tools of recovery into communities that have never seen it before. I think the other things that we've seen are the expansion of recovery community organizations across the nation as hubs to provide those important peer support services. So those are a couple of things I would cite.
Recovery is an American way of life. I totally believe that and believe that all my career. What do you see as the challenges in the next 5 years, Mr. Del Vecchio?
Yeah, I couldn't agree with you more, first, Neil, about recovery being all about American way of life here. And, we define recovery as people on a process to improve their health, to live a self-directed life, and to achieve them. You think about these 3 concepts: health, self-direction, and full potential. It's about life, liberty, and the pursuit of happiness. It's about these fundamental American principles. It's about what recovery is about. As I look to the future, certainly the crisis that we're facing in terms of overdose prevention, and we need to do a better job bringing recovery community and harm reduction together. We're already seeing that happening in a number of places across the nation. We continue, I believe, to, experience this social exclusion, what's been called stigma. The idea that disbelief that we don't recover or that we're not capable of contributing to the solutions that are needed. And those are deep-seated public attitudes that we need to continue to fight and overcome.
When I first came into this field, I worked with Marty Mann, who is the founder of the National Council on Alcoholism and the first woman to stay sober in the Fellowship of Alcoholics Anonymous. And I asked her at that point the same question I just asked you about the challenges in the next 5 years. And this was back in the 70s. And she said, fighting stigma, and fighting stigma. It's a matter of educating people to let people know something that I've been saying my entire life, which is the bright side of addiction is recovery. When people find that, they become better than better. And I'd like to ask you what your message is to those people listening to this now, people in recovery. What's your message to them?
Well, just that, support is available. Peers and family support is so critical on our journey to recovery, and that, you're not alone, that there are many people out there that can support us on this journey of recovery because, there is hope. As you said, and as the data points out, with this recent data release that we just issued, that 7 in 10 Americans, that's over 20 million Americans, have achieved recovery. And, our goal is to even spread that further.
Recovery is living proof. And I appreciate your time. I look forward to spending some time with you face-to-face down in Texas at the great conference, the TAP Conference, Texas Association of Addiction Professionals. I look forward to seeing you down in Texas. I thank you for your time today. And the bright side of addiction is indeed recovery. Thank you, sir.
Thank you, Neil.
I hope you've enjoyed my chat with the Office of Recovery's Director, Paolo del Vecchio. Now, that's a brief overview of the national focus on recovery. And of course, each state has its own focus. Here in Washington State, Governor Jay Inslee recently cut the ribbon for a new facility, the first in the nation, a facility that expands capacity. It's a neonatal center for opioid withdrawing infants. The program, which is at Evergreen Manor, which, by the way, just celebrated 50 years of treating people with addiction and focusing on long-term recovery. This new program will improve outcomes for birth mothers and their children by keeping the infants with their moms during treatment. At this event where Governor Inslee cut the ribbon, regarding addiction, he said, when people are given the chance, they take it. I caught up with the governor on the way to his car following the ceremony, and here is what he had to say.
Governor, I'm with iHeartRadio. You made a comment today, when people get the chance, they take it. Can you elaborate on that a bit?
Well, I think there's misconceptions about recovery. One is it doesn't work. In fact, it does. When you get a person with motivation and you give them the resources, very frequently they can recover. And it's a hard road. This is not an easy thing. And sometimes they have to do it twice. Sometimes they have to take 4 times. But the number of people that I've known in my life who have recovered and gone on to return to work, return to their families, it's just an extraordinary success story. But the demand is growing, unfortunately, and I'm glad the state's stepping up to the plate.
Recovery is an American way of life.
I like that.
Recovery certainly is an American way of life in Washington State, and I hope it's in your state as well. By the way, I want to remind listeners of this podcast that if you would like to tell your story of recovery, regardless of the path that you've chosen, and as long as you have been in continuous recovery for a year or more, please drop us an email if you would, recoverycoasttocoast@comcast.net. Coming up next, actor Dick Van Dyke will share some thoughts on recovery, eye to eye. We'll do that in just 30 seconds.
Alcohol is running your life. You want help, but can't take time away from work to get it. Where do you turn? Contact Sundown M Ranch. Sundown M Ranch outpatient programs have helped thousands recover from addiction without losing time on the job. Nationally recognized for innovative, effective, and affordable treatment programs, Sundown M Ranch will help you put your life back on track. Go to www.sundown.org to learn more.
And now, as promised, here is the iconic actor Dick Van Dyke talking about recovery.
Never bend your head. Always hold it high. Look the world straight in the face. Helen Keller. As a teenager, I was extremely self-conscious. When I recall those years, I can still feel the emotional pain I endured. One of the most difficult challenges for me was talking face-to-face with other people. I tried hard to sidestep such confrontations, and when they were unavoidable, I sought refuge in various mannerisms and techniques that I thought were uniquely mine. By staring at a person's forehead, ears, or chin, for example, I could escape eye contact. By performing rituals in lighting and smoking cigarettes, or by faked coughing fits, I could lessen the intensity of my fear and my discomfort. One of the most uplifting aspects of my early recovery was discovering that I was hardly unique in my painful self-consciousness. What a relief to be able to laugh along with others who had developed similar techniques to avoid eye contact. And what a bonus to be able to talk about my low self-esteem and fear of people, and to benefit from others' similar stories. When I stopped trying to hide from people, my self-consciousness gradually diminished. Slowly but surely, my sense of self-worth has risen. Today, one of the most valued freedoms I have is being able to easily and fearlessly talk with other people, and to look them squarely in the eye when I do. Thought for today: the best cure for terminal uniqueness is to see yourself in another. Never bend your head. Always hold it high. Look the world straight in the face. Helen Keller. As a teenager, I was extremely self-conscious. When I recall those years, I can still feel the emotional pain I endured. One of the most difficult challenges for me was talking face to face with other people. I tried hard to sidestep such confrontations, and when they were unavoidable, I sought refuge in various mannerisms and techniques that I thought were uniquely mine. By staring at a person's forehead, ears, or chin, for example, I could escape eye contact. By performing rituals in lighting and smoking cigarettes, or by faked coughing fits, I could lessen the intensity of my fear and my discomfort. One of the most uplifting aspects of my early recovery was discovering that I was hardly unique in my painful self-consciousness. What a relief to be able to laugh along with others who had developed similar techniques to avoid eye contact. And what a bonus to be able to talk about my low self-esteem and fear of people, and to benefit from others' similar stories. When I stopped trying to hide from people, my self-consciousness gradually diminished. Slowly but surely, my sense of self-worth has risen. Today, one of the most valued freedoms I have is being able to easily and fearlessly talk with other people, and to look them squarely in the eye when I do. Thought for today: the best cure for terminal uniqueness is to see yourself in another.
Well, that wraps up this edition of Recovery Coast to Coast, the national podcast. If you've enjoyed our podcast, please share it with others via social media or simply by telling a friend about it. You can find all of our podcasts at recoverycoasttocoast.org. And if you'd like to get in touch with us, our email is recoverycoasttocoast@comcast.net. And please hit the subscribe or follow button. It's free. You'll be notified the next time we publish a podcast. And remember, if you know someone who is experiencing problems with alcohol or any other drug, here's a 24-hour national helpline that offers free information and confidential treatment referrals. Spanish-speaking individuals are available as well. 1-800-622-HELP. And we encourage you to check out findsupport.gov. It's a fairly new website designed for individuals, families, and friends, including information on how to pay for treatment, including low-cost and free treatment options. Find healthcare support there as well. How to help someone else or even find help for yourself. It's all in one place at findsupport.gov. And join us next time for America's Voice for Recovery, Recovery Coast to Coast, the national podcast. And another shout out to our sponsoring organization, Sundown M Ranch, where recovery begins. Sundown.org. I'm Neil Scott, reminding you to stay healthy, live in gratitude, and be kind to others. Remember, the bright side of addiction is recovery. Pass it on.